lot of you guys have to be dancing in heels these days, and there can be issues. Typically, one of the main injuries we see with heels is the ankle sprain. Go and watch the ankle sprain videos if you want to know more about that. What we're going to look at in this video is how do we prepare for a heel class? What are the sort of things we want to look at that might be risk factors for when we're wearing heels? And Keris here is just about to go into heel class, so it's perfect time to have a quick look. So a lot of people don't necessarily have particular pain wearing heels. Keris is saying she doesn't really have issues, but it's just like those jump landings and things. You're kind of like, oh, am I secure? Am I safe? So we want to look at, have we got the good stabilization in the right places? What are the sort of things you want to look for? So as dancers, and what this whole platform is about, is helping you to become a detective, right? What are all the jigsaw pieces you want to go and have a look at in order to be sure that you're protecting yourself going forwards? We always want to be preventing things from happening rather than waiting until they've happened and trying to patch things up. So this is really a good preventative video. What sort of things do you want to check out about yourself before you go into your heel work so that you're good to go and stable? Okay, so let's have a look at, we're going to have Keris lie down for this one. And we're going to start looking at the ankles. Obviously, this is the vulnerable area when we're in heels. When we're up in that sort of rise position, which is obviously what a heel puts you into, we're actually in a relatively unstable place. The ankle joint is unlocked in that orientation. Therefore, we have to be particularly mindful about making sure we've got the appropriate stability. So I'm going to start by looking at Keris's feet and just having a little scan to see, is there anything that jumps out to me that might be a little risk area that needs attention. So the first thing I always do when I want to look at stability for the ankle is I'm going to look at what's called the subtalar joint. If you don't know what that is, check out the ankle video and you'll see where that anatomy lies. But the talus is the bone that's right in the middle of the ankle there. It's the one that rolls forwards when we point our foot, and everybody wants it to be shown off beautifully in that pointed foot orientation. The subtalar joint is the joint underneath the talus where it sits on the heel bone, the calcaneus. So I'm going to check, and we're obviously going to check both feet so we can look for asymmetry. If we've got differences between right and left legs, that can also be a little bit of a risk factor. So in this position, I'm just going to have a look at what motion she's got at this joint. Now, this joint allows the heel to swing in and the heel to swing out. So I can show you on this one too. We're swinging in, we're swinging out. And what I'm looking for is how balanced that is right to left. Now, I'm already noticing on this right foot that we go in nicely, but going out, you can kind of feel there, it's what we call a hard end feel. It doesn't have that spring to it. This one, however, is a little springier, so it actually goes further, and there's actually a little bit of bounce there. Sometimes that can be because of a difference in leg length. So actually, her right leg is a little longer than the left. Now, people freak out when I say, oh, your right leg's a bit longer than your left. I'm imperfect. Things don't match. Bodies are not symmetrical. They're roughly symmetrical, enough to make us believe that they're symmetrical. But actually, there are always subtle differences. And it can make the difference in how our legs operate. We often find as dancers that standing on your left leg, gesturing with your right, you have one set of organizational factors. On the other leg, you kind of have to do different things, right? Because they're not exactly the same. So with a longer leg, we tend to compress some of the joints because we're trying to level ourselves up. So that's often the case that we can see that. Now, we know we don't have a history of ankle sprain, which is grand. So these are not by any means unstable ankles, but I would be just a little concerned that we want to get that heel joint on this side to have a little bit more outward motion. And that's simply something that can be done with mobilization. Really, that's something that would be done by a healthcare provider. I'm not really showing you things that the healthcare guys do that we do in a clinical setting. These are more things that you can do for yourself. Okay, the next thing I want to look at is how does the foot refer the forces all the way up the chain. I'll talk a lot about the kinetic chain. Kinesis means movement. The kinetic chain is how everything organizes through the whole structure. Nothing in the body works in isolation, right? So what I'm going to do is putting my thumbs on that talus bone, I'm going to just flex and point the foot, and this kind of mimics us moving in space. And what I'm looking at is what happens further up, particularly in the thigh area when I do that. So as I do that on this leg, I don't know whether you can feel that, Keris, the upper leg is rolling in a little bit. It's doing a little bit of what we call internal rotation. That's telling me that the fascia that's around the muscles here, go and look at the fascia video if you don't know what fascia is just wanting to pull her into a turn-in position. It's also giving me more jigsaw pieces. Remember, this is a detective story. What are the jigsaw pieces that's telling me about? And we'll get into how that plays out a little bit later. And on this side, that goes straight up and down. Yeah, you feel the difference? Suddenly you're thinking, oh my goodness, my two legs are completely different. It's subtle, but it's there. So this one I'm not as concerned about. This one, again, it's typical on a longer leg. We often have to make these collapses. When you're standing on the floor levels your feet up, so the body wants to keep that pelvis level, so it'll often make some compensations in here to allow for the hips to become level. So before we're getting into a standing position, I want to be making sure that we're loosening up this fascia here. Now this is, when this particular band of fascia gets tight, it kind of comes around inwards this way. And what I say to people when this is feeling a little bit tight, I always say it's a bit like having your leggings on twisted. It has that sort of feeling like it's pulling you into a turn-in position. So we want to make sure that's nicely released. And you can do this on yourself, just sitting up, just gently rolling. The fascia is very superficial. It's on the surface level between your skin and your muscle. So you don't have to press very deep. And just rolling the leg here. I bet we've got a difference here. Yeah, this one you can see rolls quite easily. I can just use one finger and it's nice and bouncy, whereas this one, just a little heavier. It just feels a little bit more bound together. So we want to get that nicely softened up so that we're not pulling that knee inwards when we're in the heels. Remember that heels essentially exaggerate everything that's there. So you can just sit and do this little roll. I don't advise using a foam roller for this sort of work. The foam roller tends to compress and stick that fascia down. We want to use this more what we call sort of dynamic movement, where you're literally just wanting to move that fascia. Fascia's like cling wrap on the muscle. We want it to glide nicely and not be all gluey and bound together. Okay, before I move a bit further up, what I also want to check is the soft tissues, the muscles in the lower leg. Now, we all know working in heels tightens things up a lot, particularly the calf muscles. So if you bend this knee up for me, and we'll just pop that foot flat on the table here. So in this position, we've got those muscles nice and loose, so we can have a good assessment of how tight they are. So just giving a bit of a waggle there. So her outer calf muscle's not bad at all. The soleus, however, which is the second layer of calf muscle, is a little tighter, and particularly around this middle area. This is where the Achilles tendon turns into the soleus muscle and it's the most loaded part of a calf. So again, this is a spot, if you sit with your knees bent, get your fingers into that middle spot, and just do what I'm doing here, just give it a little shake. You just want to loosen up, shake these things apart. Don't dig into things and cause yourself pain. You don't need to. How's that feeling in there? Feels nice, yeah. It should feel nice. It should feel relieving more than anything. Okay, so we're opening that up. What I also want to check is this inner edge, just inside your shin bone. If you just tuck your fingers around the edge of it, you can come around this way on your own leg. And just have a feel in that little lower, we're in this sort of lower third of the shin. We've got some other muscles under there, and it's a little sticky there, isn't it? That come around the ankle bone here, their tendons come around here, and that's a little tight in there too. There's a particular muscle here called tibialis posterior. Go and check it out on the ankle video. But it's the muscle that pulls your foot into a sickled position. Now that's the vulnerable bit, right, rolling to your little toe. That's the vulnerable place for ankle rolling, right? So if that muscle's tight, it's going to want that foot to be pulled in a little bit, and therefore it's increasing that risk of you drifting off towards your baby toe. So we can just do a little loosening around that lower, so it's about the lower third of your shin bone. And all of these things, you don't necessarily, I mean, did you know that that was tight before I stuck my fingers in there? No. So it's not necessarily giving you symptoms, but when someone like me goes and sticks fingers in little corners like this, you're like, ooh, didn't know that was there. So if we don't know it's there, we don't deal with it. So I'm just showing you the places to go look. Get your detective hat on, your magnifying glass out, and go and have a look at these things. The other muscles to have a look at are the muscles that balance that tibialis posterior that pulls the foot inwards, and they're on the outside. These are the peroneal muscles. The peroneus longus runs all the way down the outside of that shin. And again, little tight there. Most dancers are tight in their peroneal muscles. So this is the muscle that's going to pull the foot outwards. So we want a nice balance between in and out with these muscles. So a little release into those can be great. But what we also want to do is to strengthen up those muscles. So particularly if you've got somebody whose ankle likes to go in, doesn't like to come out, if you've got a history of ankle sprains, then we really want to get these peroneal muscles strong so that they can keep and stabilize that foot into a neutral position and offset the tendency to want to sickle and go into that position. So a good way to do this is with a TheraBand. So I'm just going to get a little band here. Fitness bands, elastic bands. There are lots of different brands available for this. If I get you to sit up actually for this one, then you can see what's going on, because you can do this for yourself. So what we want to do is wrap the band around the front of the foot, so you can go over the sort of ball of the foot area and then double wrap it round. And for this one, we're wanting to exercise these outer muscles, so we're going to have the foot coming out into this orientation, so you want the long bits of your band on the inside. So if you take a hold of those, and we're going to bring that foot into a sickled position, and then you're going to take your toe out this way against the resistance of the band. Good, and come back. And then go back again. Good. And come back. So we want to make sure the leg is nicely parallel so that we're really refining it down to those particular muscles. Excellent. Okay. So good exercise to do, maybe sort of 3 rounds, give your leg a rest, repeat another 3 rounds, give the leg a rest. And then after you've done that, you can again just give your little muscle there a little loosen up after you've exercised it. If you go and watch the stretching series of videos for the lower leg, I'll show you some stretches for those muscles while we're there. Okay, just one other thing to look at that I'd be curious about for people working in heels, because you're having to go up onto the balls of the feet essentially, and there's a lot of force coming down. I'd want to be looking at the alignment of the big toe joint and also the flexibility of the big toe joint. You can go and check out, there's a whole video on bunions, which Keris doesn't have, which is great. But that's often with bunions, along with bunions goes restriction of this joint, and you can be find it difficult to get up on in high shoes, and then you tend to drift towards your little toe, and then you're in vulnerable territory again. So what we want to do is bringing the ankle up so that it's flexed as if you were in a standing position, and then I'm just going to draw that big toe back, and really we want to be seeing about sort of 60 degrees. It's actually a little bit stiff in there. Can you relax the muscle? I can see you're actually doing it. It's really hard, isn't it? Dancers aren't very good at letting go of muscles, but there we go, so that's better now. When you're activating the muscle, it was actually blocking the stretch, so we want to see if we can get that big toe back there. Check out the bunion video, and I'll show you how to mobilize and stretch into that if that's an issue for you. And we can check this one as well, if I just bring you up that way, and then we bring that toe back.
Oh, wow.
Difference? Yeah. So this is all part of what's happening on this leg. We've got this little collapse roll going on that is forcing the sort of the angle of force this way, which will land up at your big toe. So you could end up doing a lot of heel work that could end up stressing that big toe joint quite a lot. So we need to just unravel that pattern. So those are some things to look at in a sort of lying down or sitting position. Now we're going to look at some standing little diagnostics and exercises to help you stabilize in the standing position. Okay, so now in a standing position, we're going to look at the stability in action here. So we're going to start with just a single leg plie, so in parallel. And what we're looking for here is alignment. Does the knee fall over the foot? But also, what's the control like when you do that single leg plie? So let's start with the left one. So if you stand on that one first, and then just do your little slow plie. Good. Okay, we're not too bad there. It's a little bit of a kind of wiggle. Just have another go. Ooh, 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 ooh. So a little bit of sort of auto, I call it the auto-correct, right? The body's going left a bit, right a bit. And then let's do this leg. Yeah, so this one we've got a little knee waggle going on and a little bit of tremor. So you can see sort of less coordination on that side. Remember that muscles work like like instruments in an orchestra, and they all have to coordinate together. So we want to make sure that everyone in the orchestra is doing their part. And there's one particular muscle that I can sense with my Scooby senses is not playing its part. And it's a muscle called the gluteus medius muscle. And it's up in the side of the hip here. If you just turn yourself sideways so I can draw it on, just move your arm in front. It's like a sort of teardrop shape just at the side of the hip here. And it's underneath your glute max muscle. But its job is to control the thigh bone, and it brings the thigh bone away from the body, which is called abduction. So if it's a little tight, do you mind if I press into that muscle? So I'm just going to stick my thumb. Oh, hello, yes. That's a little tight, and if I test it against the other one, that's a bit tight too, but it's not as tight as this one. So again, we talked about that longer leg. If you just turn face camera again, what often happens is we get a little bit of dropping in on this side. The knee tends to drop in when we plie, and then this glute medius gets tight. When it's short and tight, it's weak, and therefore it can't control that thigh and keep the knee over the foot, so we get that little sort of hesitation as we go down. So what we want to do is open up that glute medius. The best way to do that is actually using a ball if you have one, and I'm going to show you a little way to open it. And it's really great, it's quick and easy, 20 seconds, and it'll open up that glute medius really nicely, and hopefully we'll see the after effect of that. So we're going to have you lie on the table with your head this way. Now you can do this on the floor. The best way to do it is up against a wall. I'm going to be the wall in this case, because if we did it up against the wall, you wouldn't be able to see it. So I'm going to pretend to be the wall. So what we're going to do, I'm going to switch sides here. If we bring that arm up so that we can see where we're headed. So that glute medius muscle is up in the side of the hip here. We want to stick that ball right in it. Now, when you find it, you know it. So even if you don't know where your glute medius is, if you put the ball roughly in this area. Yeah, I'm going to sweeten it up a little bit higher, I think, for you. You can kind of play around and you'll know it's like, oh, that's the spot. Okay, what we're then going to do is put ourselves into the piriformis stretch position. Go and check the stretch videos for that, but you'll see it here anyway. So we're going to bring this leg up at 90 degrees, so the thigh straight up to the ceiling. And we're going to bring this one into a retire position with the foot here. And then you can hold on to that thigh there. And now we've got the ball roughly in the right spot, but we just want to sweeten it up a little bit more. So what you would do, if this was your wall here in the studio or at home, you're going to tilt yourself towards the wall so that you can let your body weight hang into that. Are you feeling that? Mm-hmm. Normally you get that, the eyes kind of go, ooh, when you hit the spot. When you find that spot, just hang out there for 20 seconds. You want to be completely relaxed so you can just lean into the wall, let gravity do the job for you, and just let that muscle do a deep sigh. And again, you can take a nice breath and breathe out into that little stretch. Okay, I think we can probably do another one. If we just take it a little bit closer in, does that feel like, yeah, hitting another spot there? So we'll do another round there. You can sort of hit different spots because the ball's quite local, and then lean yourself into me. Yeah. Got that little from Keris there. So that's really kind of hitting that spot. So again, we'll just hang out there. This should feel what we call that sweet sensation, where it's just kind of, but it's not super painful. If it's super painful, then you're just aggravating the muscle. Pain is an alarm signal. Don't just run through alarms. If your smoke alarm goes off, don't just take out the battery, okay? All right, feeling, did it kind of lessen in pain the more you sit there? You'll find it desensitizes as you hang out there. Okay, so let's come back to standing and see if we got any change in that. So back into parallel, so let's do our single leg plie on this right leg now. Okay, and down we go. Oh, yeah. So still a little bit of a wobble, but much more organized, isn't it? It's just like, oh, boom, we're going down. So now we've got that glute medius back in the orchestra, and we haven't got quite so much auto-correct going on. Okay, relax yourself down. So when we're in heels, obviously there's a lot of balance going on. So we wanted that big control from the hip area, but we also want our feet to be able to make micro adjustments. A lot of people think that balance is about like hitting that spot and not moving, right? That's not actually a successful balance. That's very precarious, because if I just came along and nudged you, you'd fall over. A good balance is about the ability to autocorrect, to make those micro adjustments, and the brain is sort of going, you know, right a bit, left a bit, forward a bit, back a bit, and making those little auto corrections. So a good way to practice this is by using a balance disc, a wobble board. If you haven't got either of those, get your sofa cushion or pillow and put that on the floor. And we're going to do a little balance exercise. Now, there's a whole video on balance, so go and check that out if you want to assess your balance and learn some other techniques to improve balance. But what we want is for all those muscles in the leg to work together in a coordinated way. And what we also need, particularly if we're in performance, when you're on stage, well, when you're in a studio, you're getting a lot of your balance cueing from your eyes. You're always like looking at things. You get on stage and it's just like blackout and blinding lights, and you've got nothing external to use as cueing. You have to rely on your internal system of cueing. So let's, first of all, before we get onto the disc, let's just try standing on this leg. Now we're going to do a particular test where you're going to cross your arms over the body. You're going to lift the other leg behind you, but not touching this leg. And then again, just do a single plie on this leg. Great, and come back up. And now just stand there. Close your eyes. Okay, she's not bad at all. Okay, so that's a sequence. Go and watch the balance video and I'll take you through that in more detail. But that's a good way to see how reliable your internal balance cueing system is. To sweeten that up, what we can do is I'll have you stand on this. So this is a balanced disc that gives you a sort of uneven surface. So if you stand both feet in parallel on that disc there, so it's going to force you into making all those little micro adjustments, and you can feel that's happening right up to the hip here. So everything's being woken up. We're also exercising all the nerve pathways that do the signaling for the muscles, so that we're giving them a good little workout as well. So the idea is to get yourself so that you're as stable as you can be on the unstable surface. Once you feel like, yeah, I'm pretty good here, I can hang out, you can progress to doing that with eyes closed. Okay? And there, whoa, you see how it gets challenging. Always do this up against a wall, something that you can hold on to. I'm standing here just in case you get a wobble, because when you close your eyes, it really changes it, doesn't it? Yeah, well, you're wanting to pitch right forwards there. So it's a really good way to assess what's your internal cueing of balance like. Okay. As we get better with this, with the eyes open, if you step off for a moment, with your eyes open, you can then progress to one foot. Maybe do that with your left foot. So come and stand right in the mid. So, all right, do it on the right one. That's okay. So now we've got all the body weight going through the one leg. And again, you can progress to doing that with your eyes closed, seeing how that sweetens it up. Yeah, I need to put that other foot down. Okay, and come back off again. And then you can progress to, once you start to get really stable on that, you can actually start to do some extensions and things on there. Okay, so they're just some things that we can do to prepare ourselves for the heels. So now, if you want to go and pop your heels on, we will have a look at what we need to do in the once we've got the shoes on. Now, we all know that what tends to happen is the weight gets pitched forwards, okay? So we're essentially standing on a downhill slope, if you think about it. What typically tends to happen is the muscles at the back of the legs are going to get tight. That's your hamstrings, your calf muscles, because when we're pitched forwards, the muscles on the back grip to stop you from falling forwards. So you can just try this. If you stand in parallel straight, move your weight towards the balls of the feet and see what happens at the back. Whoa, everything starts to grip. This is particularly an issue if you're working in theatres on a raked stage. If you're from England, where I'm from originally, I did a lot of my performing in British theatres, which a lot of them tend to be quite raked. So if you're in heels on a rake, you've got like double the elevation change going on. So you need to be very mindful about your stretching. So after you've done your heel work, we want to make sure that we're doing good calf stretches, hamstring stretches. Again, go and watch the stretch videos to give you specifics on how to do those. Other muscles that get tight when we're in heels is often the muscle at the front of the shin as well, called the tibialis anterior muscle. So again, watch the stretching video series to look at how we release those muscles, because you have to be very specific about how you do that. Okay, so what we're going to look at now is just what happens. You want to come back in, Keris, come and join us. She's got her lovely heels on. So these are nice. They're a good shoe because they've got ankle support. If you're in just a stiletto shoe, sometimes often we don't have control over the footwear, right? It's costume design department that decide what shoes you're going to wear, and you've got to make do with them. And sometimes they can be even like regular street shoes that don't really have good ankle support or anything holding the shoe on. So you really want to make sure you've got something to support that shoe being held to the foot, because if not, we tend to grip with our feet, and then we can get crampy as well. So when we're in the heel here, if you just turn sideways for us, if you have hyperextended knees, you don't have too much there, but it will exaggerate it, right? So we need to be mindful of that. So we almost need to just take ourselves off full extension of the knee, Now, typically as dancers, we're always trained like, have your weight over the balls of the feet, right? When you're in the shoe, you really want to do the opposite because the shoe's doing that for you already. So what you can do, so rather than thinking of having the knees bent, so that feels like you're a little bit kind of gripped and a bit kind of shortened, a good image to use is a spiral motion. If you turn to face the front again, if you think of a spiral, like a candy cane spiral, spiraling outwards all the way up the legs. So the legs spiral, 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 and we want to spiral those calf muscles in particular so that we're really supporting the outside. If you just let your legs relax and drop, can you feel how your knees kind of rolled inwards and these calf muscles sort of flared outwards? So when we rotate, so even though she's in parallel, you want to use your turnout as if you were in first position. Yeah, so we knit the backs of the legs together and think of that spiral, spiral, spiral. So you're spiraling out of the shoe. The other thing is we don't want the weight dropping into the shoe. So we're spiraling out. Now, if you turn sideways again, what we also want to do is just bring our weight back a little bit towards the heel, okay? Because when we're in the shoe, we're being pushed extra forward anyway, and we're often working in a rise position, right? We're not always standing flat on the shoe. So if you just bring your weight back more over the middle of the foot, it will offset a little bit of that tendency to fall forwards. And then again, be really mindful about lifting through. She's super tall already anyway, but lifting right through the head. So we're lifting out of the shoe, we're back towards the heel, and we're in a more neutral position where our muscles aren't having to grip to hold us there. If you just push yourself sort of forward to the front of the shoe, are you finding like everything's switched on, right? So now we're all locked up, and now even if you want to do a kick, your muscles are tight. So when we come back here, I'm all about efficiency. How little effort do we have to expend to get something done? It's hard enough, right? So here, we've not got all that gripping going on, but we've also got lots of opportunities for that autocorrect for the balance, right? We're not here, you've got no options, right? It's just grip on and hope for the best. Whereas here, we're subtle, we've got all those autocorrect possibilities. Okay, so that was just a really quick rundown of things that you can look at to check for risks, instabilities in the system. Make sure you use your hands to loosen up all those tissues. Get yourself aligned and controlled for those straight leg pliés so that everything's already in that really kind of stable position before we go into the heel work. And then after you've done your heel work, stretching out the calves, stretching out the hams, stretching out the lower leg muscles, and taking care of yourselves.